ran across the concept of healthware that really rose my curiosity. Healthware, what is... You wear your health. So there are lots of new materials coming along that will merge textiles with biosensors and electronics that so you'll be able to wear and monitor yourself 24 hours a day. That I found this one that is dealing with the wearable electronic health monitoring. This blog is called Talk to My Shirt. What we're seeing here is a kind of a displacement of health monitoring. So whereas before you would go to the consulting room and clinics to have your blood pressure measured, then today you will be able to do that at home, check it out at home, in your sofa, at your table, while your beloved one brings some tea for you. So what will this imply now that vital signs and will be able to be monitored and displayed alongside all the other information that we access through our electronic equipment? The question whether these technologies really are empowering patients to take more active roles in their health, or how much of this new technology really is introducing more surveillance into our homes, into our daily lives.
How do you feel about this then being taken into the home to empower the person to make a diagnostic, not just the lifestyle, but a diagnostic, find out a result that could have huge implications without any safety net support or information other than what they would find on the web?
But it is often the well, the healthy, who fear surveillance. If you're actually ill and that's surveillance and that smart textile technology can save your life, I think you think of the surveillance in very different terms.
I presume that the methods of the various diagnostic techniques are based on some particular formula. I dare say if something changes and it turns out that those methods of measuring turn out to be wrong, that has quite important concerns. And of course there is no, or very little from what I can see, instruction to speak to a human being like your doctor to check your results.
In terms of collecting, might it not be as interesting to collect the data sets that these machines generate as it is to collect the machines themselves? In some way, these things are kind of generating some sort of image of a life pattern. You could turn that into some quite interesting display material.
How to make films now, everybody can be their own filmmaker, their own photographer, their own doctor, their own nurse. And these raise some issues that, because we're living in a screen-focused culture, we are also becoming our own experts in every field of life.
Maybe having an exhibition in which a user is a co-curator and you hear the first-person narrative about what it's like to live with this continual dimension to your life, I think could be a quite powerful exhibition.
Historically, there was a lot of anxiety with health museums and science museums about looking out for certain symptoms, for health conditions you might have, and the medical fraternity were quite angst-ridden about that. You know, how could we possibly trust the general public to have some sort of responsibility for looking at their own health issues?
From my point of view, I can't think of anything more unhealthy because I'm obese than knowing what my health might be all the time. There's kind of frivolous side to that, but actually it's a world of universal hypochondria. What